Gather equipments, check medication order against the original order in a medical record, according to facility policy, clarify any inconsistencies, check the patient chart for allergies. Know the action, special nursing considerations, safe dose range, purpose of administration, and the adverse effect of medication to be administered. Consider the appropriateness of medication for this patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare the administration in the medication area. Unlock the medication cart or drawer. Prepare the medication for one patient at a time. Read the CMAR or MAR and select the proper medication from the patient medication drawer or unit stock. Compare the label with the CMAR or MAR. Check the expiration date and perform calculation if necessary. When all medication for one patient have been prepared, recheck the label with the CMAR or MAR before taking them into the patient. Lock the medication cart before leaving it. Transport medication to the patient bedside carefully and keep the medication in his sight at all times. Ensure the patient receive the medication at the correct time. Perform hand hygiene and put on PPE if indicated.
Good day, ma'am. I'm here to Administering student for today. Can you state your name and your birthday?
Identify the patient. Usually, the patient should be identified using two methods. Compare the information with the CMAR or MAR. Check the name and identification number on the patient identification band. Ask the patient to state his or her name and birth date. If the patient cannot identify him or herself, verify the patient's identification with a staff member who knows the patient for second source. Complete necessary assessments before administering medications. Check the patient allergy bracelet or ask the patient about allergies. Explain the purpose and action for each medication to the patient. Scan the patient barcode on the identification band if required. Put on gloves. Assist the patient to his or her left side in a Sims position, drape accordingly to expose the buttocks. Remove the suppository from its wrapper. Apply lubricant to the rounded end. Lubricate the index finger of your dominant hand. Separate the buttocks with your non-dominant hand and instruct the patient to breathe slowly and deeply through his or her mouth while the suppository is being inserted.
Okay po. Ano pong malamin? Ano po?
Using your index finger, insert the suppository round end first along the rectal wall. Insert about 3 to 4 inches. Use toilet tissue to clean any stool or lubricant from around the anus. Release the buttocks. Encourage the patient to remain on his or her side for at least 5 minutes and retain the suppository for the appropriate amount of time for specific medication. Remove additional PPE if used. Perform hand hygiene. Document the administration of the medication immediately after administration. Evaluate the patient response to the medication within the appropriate time frame.